Health Watch is presented by UMass Memorial Healthcare. Here, caring for you.
Welcome to Health Watch, presented by UMass Memorial Healthcare. I'm Brittany Schaefer. Today's topic is pediatric cancer.
Pediatric cancer overall is very rare. It's about 2% of all the cancers diagnosed in the country every year. But that being said, there's approximately 15,000 cases per year in the country, and almost 1,500 children will die every year of pediatric cancer in the United States.
What is the most common form of pediatric cancer?
The range of pediatric cancers are very different from adult cancers. Most commonly leukemia and lymphoma, followed by brain tumors, and then other solid tumors such as neuroblastoma or Ewing sarcoma or bone cancers.
What causes pediatric cancers?
Pediatric cancers are typically driven by genetic mutations, although for most of them we don't know the exact cause. They aren't caused from cigarette smoking or other exposures that most adult cancers are caused to. So they're developmental cancers that just arise by themselves. There are some very specific types of cancer that are caused by familial genetic disorders. Those are particularly rare in pediatrics.
Are there certain warning signs parents should be aware of?
In children who are otherwise well, a fever that's not going away, abnormal bruising or bleeding, those are signs of leukemia. There are also other types of cancers that present with physical symptoms. For instance, a young child who starts limping or refuses to walk, that's a significant sign of something wrong, and that child should see a doctor. The other thing is brain tumors are common in children, or one of the more common types of pediatric cancer. Brain tumors can present with headaches or rapid changes in vision.
Why are hematology and oncology services typically grouped together?
Pediatric hematology and oncology are typically two subspecialties that are grouped together because primarily leukemia is a blood disorder, and it requires diagnosing problems within the bone marrow, and that overlaps with a series of blood disorders, i.e. hematology disorders, for instance, sickle cell disease and other problems with blood production. So in pediatrics, hematology and oncology are mixed together, where we specialize in taking care of all children with blood disorders or cancers.
What is unique about the pediatric cancer services at UMass Memorial Children's Medical Center?
University of Massachusetts Memorial Medical Center has a comprehensive pediatric cancer center. We treat all types of pediatric cancer, and we also work closely with the programs in Boston and in Western Massachusetts to ensure that children get the absolute best care that's available in the state. We have a small group of very dedicated hematology oncology professionals here, including nurse practitioners, physicians, social workers, child life workers. We try to take care of the entire family as well as the patients. So it's it's an outstanding program. It's small, but it's also very personalized. For the optimal care of a pediatric cancer patient, it requires a complete team of professionals, including not just the medical care, but also taking care of the child's psychological and social development. And we want to always ensure that children get integrated back into their normal life and make their life as happy and productive as possible.
How has the treatment of pediatric cancer advanced?
Pediatric cancer is one of the real success stories of modern cancer research. We have increased survivors and survivorship for the majority of pediatric cancers, so that now in 2018, survivorship for leukemia is almost 90% of children. Just 20, 30 years ago, that number was closer to 5%. So we've made incredible strides in treating leukemia and other types of pediatric cancer. That being said, there are still very difficult types of tumors where we don't have as good success rate, and we're really working hard on that.